Proposition 34, I'll tell you ahead of time that for me, this proposition and the next proposition were two of the more complicated ones because they deal with just complicated matters. So I'm doing the best I can to try and explain this. If you have any questions, you can always post them on YouTube and I'll try and research them if I didn't answer them here. So Proposition 34, if it passes, would restrict spending of prescription drug revenues by certain healthcare providers. And that's like a vague summary, so hopefully by the end that will make some sense. So first, as with all of the propositions, how did it wind up on the ballot? It was initiated outside of the California legislature. It was introduced via a state initiative process. Once again, that's getting enough signatures to qualify for the ballot, signatures that are verified by the Secretary of State. And then if they get enough, it's on the ballot. That's how it wound up there. Now, what are the potential policy changes if it passes? If Proposition 34 passes, it would change how certain healthcare providers use their revenue from the 340B drug pricing program, which for the remainder of this presentation, I'm just going to refer to as the drug discount program. This program, which was started in 1992, allows certain healthcare providers to buy prescription drugs at large discounts. It's a federal program managed by the United States Department of Health and Human Services. Okay, and so that's why you're going to hear me talking about federal government and state government as well in all of this. So here are the potential changes if Proposition 34 passes. First, Proposition 34 would require certain healthcare providers, specifically those benefiting from this federal drug discount program, to spend at least 98% of the revenue earned in California on direct patient care. Now, this provision applies to hospitals, clinics, and other providers that serve low-income communities and participate in this drug discount program. The goal is to ensure that the revenue generated by the drug discount program is used directly on patient services rather than other activities like administration or marketing. Healthcare providers would have to report annually to the state detailing how much revenue they earned from the federal drug discount program and then how that revenue was spent. The state would use this information to monitor compliance with the rules of Proposition 34, and it could charge fees to relevant healthcare providers to cover the costs of enforcing the new rules. If a provider doesn't provide the 98% of revenue on direct patient care or fails to report its revenue accurately and expenses accurately, the provider could face significant penalties. These penalties include, but are not limited to, losing their healthcare license for 10 years or losing their tax-exempt status. What it would also do is it would codify the Medi-Cal Rx program. So let me explain what this means. Like I say, the Proposition 34 would make the current drug payment system called Medi-Cal Rx as part of state law. This wouldn't change the system, but would officially set Medi-Cal Rx as the way that for prescription drugs to be paid under Medi-Cal. So Medi-Cal Rx is a program that handles prescription drug coverage for people on Medi-Cal. But Medi-Cal Rx is not currently established as a state law. It was implemented through an executive order in 2021. So in other words, Governor Newsom was able to do it unilaterally on his own. Proposition 34 would formally add Medi-Cal Rx to state law, making it the official method for managing prescription drug payments under Medi-Cal. So it's something that's passed by executive order. If a new governor comes in, they could just rescind that executive order. In this particular case, if it becomes a state law, a new governor could come in but wouldn't be able to change it. If Proposition 34 passes, some healthcare providers may choose to withdraw from the federal drug discount program if they feel the new spending or reporting requirements are too burdensome, and this could reduce the number of providers participating in the program and could affect the availability of discounted drugs for low-income patients. So what are the and hopefully that was clear, because as you can see, it's complicated. What are the fiscal impacts? Well, the proposition would require the state to monitor and enforce the rule that 98% of the care from the revenue from the drug discount program is spent on patient care. So this would likely cost the state millions of dollars each year. But the cost of monitoring and enforcing the rules would be paid for by fees charged to the relevant healthcare providers. So there might be some cost, but they would be reimbursed. Some healthcare providers may choose to increase their spending on Medi-Cal patients to comply with the proposition's requirements at 98% on patient care. If they do, this could result in savings to the state related to healthcare costs under the Medi-Cal program. However, the size of this impact is uncertain. The legislative analysts didn't even give a number on this. There could be some healthcare providers might opt to leave the federal drug discount program entirely to avoid the new reporting and spending requirements. If that happens, the state could lose access to discounted drugs, which may increase state healthcare costs, particularly for Medi-Cal. And once again, the size of the impact is almost impossible to determine, and so there was no number provided by the legislative analysts. And then finally, healthcare providers that fail to comply with Proposition 34's requirements could face severe penalties, including, as I said, losing their tax-exempt status or losing their healthcare licenses for 10 years. If an entity of a healthcare provider goes out of business, there could be broader fiscal impacts, such as changes in the amount the state collects in tax revenue or increase in state spending on healthcare services to cover the gap if these providers were to leave. So again, complicated. What are the arguments in favor of Proposition 34? Well, Proposition 34 will enforce stronger accountability measures for participants in the federal drug discount program. It'll ensure that taxpayer-generated revenues are used as intended, with 98% of the revenue on patient care. Also, the proposition redirects funds to directly benefit low-income patients by prioritizing health care over administrative or political spending. And then finally, the measure targets only the worst abusers of the program, who spend large sums of money on non-patient care activities, such as political campaigns, rather than providing essential health care. What's the argument against Proposition 34? Opponents of Proposition 34 argue that Proposition 34 is a politically motivated proposition designed to target specific organizations, particularly the AIDS Healthcare Foundation, which has been an advocate for rent control and other causes contrary to the interests of the landlords who are backing Proposition 34. Opponents argue that it's an abuse of the initiative process. Right? Additionally, the initiative could actually harm patients, especially low-income individuals who rely on services of entities like the AIDS Healthcare Foundation. By imposing strict spending rules and penalties, the measure may force some healthcare providers to reduce services or withdraw from the federal drug discount program, leading to fewer care options to withdraw from the program entirely, leading to fewer care options for vulnerable individuals. And then finally, passing Proposition 34 would set a dangerous precedent where interest groups use ballot measures to retaliate against political adversaries rather than addressing legitimate policy concerns. In terms of the endorsements from the organizations, this one is interesting. The California Republican Party recommends a yes vote The California Democratic Party didn't make any recommendation. The Chamber of Commerce recommends a yes vote. The California Labor Federation didn't make any recommendations. The Los Angeles Times recommends a no vote, and the Los Angeles Daily News recommends a yes vote. So a yes vote supports requiring certain healthcare providers, I'm going to move that out of the way, to spend 98% of the revenues from federal district drug discount program on direct healthcare patient care. It penalizes violators of the requirement with loss of tax-exempt status and license to operate healthcare plans, pharmacies, and clinics, and permanently authorizes Medi-Cal Rx into state law. A no vote would oppose all of these changes. And I'm sorry if that was kind of complicated and jumpy, but it was complicated and jumpy for me as well, trying to figure out what was going on here.